Imagine waking up in the middle of the night, soaking through your sheets, your body completely falling apart from both ends, and the real horror is on your foot. 2 small bite marks that have merged into a single, black, oozing wound that is visibly destroying your skin while you watch. That is exactly what happened to a 27-year-old woman who thought she had experienced a bad spider bite before. She was wrong about how bad it could actually get. This is a story about venom, about a medical system that partially helped but left critical questions unanswered, and about the very real line between tough it out at home and you need to be in an emergency room right now. By the end of this video, you will know exactly where that line is, because the difference can be the difference between keeping your limb and losing it. Let's set the scene here, because context matters a lot with venomous spider bites. In the United States, there are 2 spiders that medical professionals consistently flag as genuinely dangerous to humans: the brown recluse and the black widow. They cause completely different types of damage, and understanding that difference is actually critical to understanding this story. Brown recluse venom is what's called cytotoxic. It destroys tissue directly at the bite site. The wound itself becomes the main event. Skin dies, tissue breaks down, and in severe cases you can end up with a wound that looks like something out of a horror film, spreading outward from the original bite. Black widow venom is different in a way that makes it arguably more dangerous systemically. It's neurotoxic. It doesn't primarily destroy tissue at the bite site. Instead, it attacks your nervous system, causing a condition called latrodectism. The symptoms include severe muscle cramps, particularly in the abdomen and back, sweating, nausea, vomiting, and a very specific kind of full-body misery that some people have described as feeling like the worst flu of their life, combined with being electrocuted slowly. Now, here's where this particular case gets complicated and genuinely scary. This young woman was showing signs of both. She had the systemic poisoning symptoms consistent with a black widow bite: the sweating, the vomiting, the full-body sickness. But she also had the kind of tissue destruction at the bite site that looks far more consistent with a brown recluse wound or a severe secondary infection. That combination is not something you just push through at home. She had actually been bitten by a brown recluse before and survived it. So she has a reference point. She knew what bad felt like. And her instinct in the early hours was that this was probably another recluse and she would suffer through it. That instinct, while understandable, nearly cost her a very serious medical escalation. Here is how this actually unfolded. She was bitten twice on the same foot, both bites in close proximity. Within an hour, the pain she described as her foot feeling like it was melting. Not itching, not soreness, melting. Significant swelling began almost immediately. Over the next few hours, both bite sites developed what she described as dark red bubbles that then burst and began leaking fluid. As the hours progressed, the 2 separate puncture wounds essentially merged into a single wound, and then that wound began turning purple and then black at its center. This is called necrosis. This is tissue death. This is your body losing the battle at that specific location. Then the systemic symptoms kicked in. Sweating, gastrointestinal symptoms severe enough that she described it as liquid coming from every end of her body simultaneously. This is when she made the call to go to urgent care, which was absolutely the right move, though arguably overdue given the wound appearance. The urgent care physician she saw was experienced enough to immediately identify this as a black widow bite based on the combination of symptoms and the geographic context. The region she lives in has black widows as one of only 2 venomous spider options. He gave her an intramuscular antibiotic injection immediately, Rocephin, which is a powerful broad-spectrum antibiotic used specifically for serious bacterial infections. He then prescribed a 10-day course of a combination antibiotic called sulfamethoxazole trimethoprim, which is used frequently for skin and soft tissue infections. He also flagged something that should have been alarming enough to prompt a much longer conversation. He said he believed she was already developing cellulitis and that he was concerned she was at risk for osteomyelitis. Let's talk about what those words mean, because they are not words you want a doctor to use casually and then send you home with a prescription. Cellulitis is a bacterial infection of the deeper layers of skin and the tissue just beneath it. It can spread rapidly. It can become life-threatening if it enters the bloodstream. You treat it aggressively with antibiotics and you monitor it extremely closely. The fact that a spider bite had already progressed to suspected cellulitis within hours tells you how serious the initial injury was. Osteomyelitis is bone infection. The reason the doctor was flagging this is the location of the bite, the foot, near the ankle. Bones in the foot are relatively close to the surface and can become infected when surrounding tissue is severely compromised. Osteomyelitis is a serious, difficult-to-treat condition that can require surgical intervention and in worst cases can threaten the limb itself. A doctor mentioning this possibility at your urgent care visit and then sending you home is, frankly, alarming. Now we get to where things stand after that urgent care visit, and the question that was left completely unanswered: when do you actually go to the emergency room? The day after treatment, this young woman was experiencing something important. The overall redness had reduced slightly, which might sound like good news. But the wound sites themselves had developed a significantly darker, more dramatic purple discoloration, spreading outward from the black necrotic center. She had small white spots appearing in the reddened area of her foot. She was experiencing a zapping, electrical feeling shooting up her leg. Standing was painful. She couldn't bend her ankle comfortably. The itching was described as insatiable and unrelenting. Here is the critical lesson of this story. And please pay attention to this, because this is the information that could protect you or someone you love. Those new developments, the spreading purple discoloration, the white spots appearing in the tissue, and especially the electrical zapping sensation shooting up the leg, those are emergency room symptoms, not urgent care symptoms, not wait-and-see symptoms, emergency room symptoms. The spreading purple skin around a necrotic wound means the tissue death is not contained. The area of dying tissue is growing. This requires immediate medical evaluation to determine whether debridement, the surgical removal of dead tissue, is necessary to stop the spread. White spots appearing in infected, swollen tissue can indicate abscess formation or early signs of tissue breakdown that requires drainage and more aggressive treatment than oral antibiotics. The electrical zapping feeling traveling up the leg is a neurological symptom. Combined with a confirmed or suspected black widow bite, this is your nervous system telling you something is wrong beyond what's happening at the bite site. That symptom alone warrants emergency evaluation. The general rule with bite wounds that are being treated with antibiotics is this: if the wound appears to be growing, spreading, or changing in a concerning way after 24 to 48 hours of antibiotic treatment, that is not working and you need escalation of care. Antibiotics that are working should show some stabilization of the wound within that window, not an expansion of the purple and necrotic area. Additional reasons to go to the emergency room from a spider bite, even if you've already received treatment: a fever above 101 degrees Fahrenheit, red streaks spreading outward from the wound site toward the body, increasing rather than decreasing pain, any difficulty breathing or tightening in the chest, significant muscle cramping, especially in the abdomen, any signs of confusion, extreme weakness, or heart palpitations. For this specific situation, a suspected black widow bite with signs of tissue necrosis, suspected cellulitis, a physician's stated concern about osteomyelitis, and now worsening wound appearance with neurological symptoms, the emergency room is not an overreaction. It is the appropriate next step. The bottom line on treatment is also worth understanding. The antivenom for black widow bites, called Latrodectus antivenin, exists and is available in emergency departments. Urgent care clinics typically cannot administer it. If black widow envenomation is suspected and systemic symptoms are severe or worsening, the emergency room is the only place equipped to provide the full spectrum of treatment, including antivenom if indicated, IV antibiotics if oral antibiotics are insufficient, wound care consultation, and imaging to assess for bone involvement. Oral antibiotics are a starting point, not a guarantee. A single antibiotic injection is a starting point, not a finish line. With the level of wound severity described here, this case needed hospital-level follow-up, not just a prescription and a monitor it closely. If this happened to you, a spider bite that is progressing despite antibiotic treatment, a wound that is spreading or darkening, pain traveling beyond the bite site, fever, or any of the neurological symptoms described in this video, please do not wait to see if it gets better. Go to the emergency room, tell them you have a suspected venomous spider bite, you have already received antibiotics, and you need the wound evaluated for possible debridement and IV treatment. The urgent care did the right thing starting treatment. But the emergency room exists for exactly these situations, when starting treatment isn't enough and the wound is telling you that the fight isn't over. If you found this video helpful, please subscribe because we cover exactly these kinds of situations where knowing the right information at the right moment can make all the difference. Your health is worth being informed.